when I call. Big boss man, can't you hear me when I call? Well, you ain't so big, you just talk, that's all. Well, you got me working, boss man, working around the clock. As for a drink of water, you don't want me to stop, big boss man. Can't you hear me when I call? Well, you ain't so big, you just talk, that's all. Myself a boss man, one gonna treat me right, work hard in the daytime, rest easy at night, big boss man. Can't you hear me when I call? Well, you ain't so big, you just talk, that's all.
Good morning, McKinsey.
Good morning. How are you?
I'm doing
Okay,
well.
that's good to hear.
I think it's just an abundance of caution.
Well, that's good. Never too much to be safe.
Right.
Who do we have on the dais today, if you're not Steve?
I'm here, Leslie.
Are you waving at us? I think I see
I'm here, Mayor.
a body. Are you sitting over in your spot, Natasha?
I am.
Okay, it's hard to tell. Great.
Good morning.
Morning, Allison.
Morning. This is Travis County Judge Andy Brown. I'm calling to order the meeting of the Travis County Commissioners Court. Today is December 14th, 2021. It is 9:05 a.m. We're meeting here at 700 Lavaca with Commissioners Gomez and Howard. And Mayor, I'll pass it over to you to start things off on your end.
Sounds good. We have the Mayor Pro Tem who's chairing this meeting. She's live in the chamber, so I'll turn it over to her.
Thank you, Mayor, and thank you, Judge Brown. Thank you. I'm calling to order the city's portion of the joint meeting here on Tuesday, the 14th of December, 2021. The time is 9:06 a.m.
Thank you. So I'll call to order the joint meeting of the Travis County Commissioners Court and the City Council, and call up item 1 to receive briefings on COVID-19 related matters. First, want to check if we have any callers in the public comment portion of this.
Good morning, Judge. We do have one caller.
Okay, let's go to the caller, please.
All right. We will hear from Zenobia Joseph. Miss Joseph, please go ahead. You have 3 minutes.
Thank you, Judge, Commissioners, Council. I'm Zenobia Joseph. I just wanted to make a comment as it related to African American outreach. I specifically wanted to ask Austin Public Health to remove the ad that plays on KVUE. It's a Bob and Jenny skit that plays that is supposed to be trying to get parents to get their children vaccinated, but it actually is pretty culturally insensitive. Bob sounds like an older white male, and Jenny sounds like a middle-aged white lady. And it's very patronizing. Not only that, but it plays juxtaposed with the Austin City Council social welfare Thursday meeting announcement. And so I would just ask Austin Public Health to be a little bit more sensitive to recognize the target audience and to use perhaps the Marion Nickerson and Willie Anderson familiar voices to just give the information to the listening audience. That information doesn't play on KUT. I listen to both radio stations. I would also ask you, in the context of health equity and trying to reach the African American population, to do a more holistic approach and to recognize that you have opportunities at these mobile food pantries. Specifically tomorrow, LBJ High School, 4:30 to 6. Thursday, Nelson Field, 9 to 11. Friday at VA Clinic, and then Del Valley on Saturday, 9 to 11. I recognize that Travis County said it's a little difficult to reach people when they're going through the line. I would just ask you to recognize if people are waiting for food, if you use the $50 gift card, either from H-E-B or Walmart, and you have a tent on the side, they'll probably stop. But if you're just sitting there with the tent, they probably won't stop just to get shots in arms. And so I would ask you to use a hybrid approach. I know Travis County is going to be giving $50 to the nonprofits who have people stopping by for shots, but I disagree with that methodology if they're just going to sit in the lobby of a church. It needs to be something a little bit more incentivized to get the money. I would lastly ask you to provide information about utility assistance. Rent assistance is gone, and so these are social determinants of health that I'm asking you to look at more holistically. Travis County's application site is still open through December 31st for utilities. I'm not sure about the +1 on the Austin side, but if you could just collaboratively give more information, there's the health equity talk that's going on right now on KVUE from Austin Public Health. Interim Director Sturt was on last Monday with Shannon Jones on the radio. There are opportunities where you can more holistically reach the needs of the target audience you're trying to reach. And so I would just ask you to keep these things in mind and to do more than just shots in arms. I know that's important, but you have to understand the target audience and recognize.
Thank you, Ms.
The
Joseph.
question is, what's in it for me? Thank you. If you have any questions, I'll gladly answer them at this point.
Thank you. Any other callers today, Shelby?
Not at this time.
Okay. All right, I'll go ahead and turn it over to Dr. Wilkes and APH.
Good morning, everyone. Next slide, please. Next slide, there, thank you. Today is the anniversary of our first deploying vaccines this time last year. And I put this graph up to show the milestones that have been made along the way by the members of this body and the decisions that have been made by our elected officials and the efforts that have been taken by this community, by business leaders, in schools, the leadership of schools, all of the hard work of public health workers, and the work of our essential workers to keep our economy going, and all of the work of the healthcare providers in our community is represented, interestingly enough, in this graph, and you ask how. In the first two stages that are shown here, we had masking available, social distancing, but in the mid portion of December of last year, after the work and discoveries that were made right here at UT on the ACE gene, that key that is what unlocks the entry, the door that allows this virus to enter our cells and cause infection, that gene and identification and isolation of it happened here. And from that, through the work of scientists here and all over the world, we were able to have a vaccine to put this virus into the category of a vaccine-preventable illness. So taking a moment to think about that and remember all the things that you have done collectively here and all the people that are in our community have done, you see that we have been able to keep our system continuing to operate, our hospital system. We've been able to go back to work. We now have children back in-person instruction in schools. And all of those things were made possible by working together. Yesterday, I was in a meeting with someone that I knew when I was in Bastrop, who was at the first meeting that we convened when this pandemic came to our knowledge. And I was asked, what's the good news? Well, that's the good news, that we've been able to work together to keep our hospitals going and to help to save lives. And we found out, if you go to the next slide, please, that our through the work of our modelers, that we needed to do a little bit more masking, and we needed to keep doing those mitigation efforts to avoid a surge, as shown in the left-hand graph in the November-December timeframe. And we made a decision to start looking at community transmission. The number of cases over a 7-day period per 100,000, because we knew that people, this is a biphasic illness. You get exposure to COVID-19, then you develop symptoms, or sometimes there's an asymptomatic case of this, but we then see this viral loads, or the amount of virus in our bodies, increase. And we test positive and self-isolate, and some people recover and some people develop severe disease and then require hospitalization, so that the hospital numbers are something that we see rise later in time. And because we knew that that was the case, we've started to monitor that and continue our measures of masking and social distancing and guidance to the public to do those things into a period of time when we were at just trending around the threshold of stage 2 and 3. And we've been able to avoid the surge that we see on this graph. However, in the last week, our case numbers have risen by 10%. And we're seeing that nationally with a 12% increase in cases since Thanksgiving, which we anticipated would be the case given the in-person, indoor gatherings that we typically have during this holiday season. So if you go to the next slide, please, again, just outlining those definitions on the next slide of what community-based transmission has been defined as, using one of the two of these parameters based on CDC recommendations. Whichever of the two is higher is how we decide to whether we're in a state of substantial, high, moderate, or low community transmission. And in the last several weeks since the Thanksgiving break, before Thanksgiving, we had 44 cases per 100,000 as our community transmission rate, which was a moderate level of transmission. And as of the last several days, we now are in the 70 range. So that's slightly higher. As anticipated, we are seeing an increase in the numbers of cases. But again, we're also seeing an increase in our 7-day moving average of hospitalizations. We're up to 17. But again, with mitigation efforts in the past, we've been able to keep those things under control. And that's through this collaboration. The good thing about this community, the collaborative nature and spirit of the community has helped us make our way through. So in the next slide, on the 6th of December, thank you, Ruth, the CDC made an update to its self-testing guidelines and recommended that all people, regardless of immunization status or symptom status, so whether or not you had symptoms of illness and whether or not you were had received your vaccine, they're recommending that if you're planning to travel to visit with people that don't live inside your household, that you test yourself to make sure that you don't have COVID-19 so that you can help protect your loved ones and yourself, stay home and self-isolate and get better. So on the slide you see before you the considerations for self-testing. Self-tests are available in our local pharmacies, and we are distributing self-tests at our food distribution sites in our neighborhood centers. So we have testing available now to help inform everyone on whether or not it's safe for them to travel. And so this is a guidance that's been given, and we've been mentioning it in our communications with the public, and strongly recommend that this be added to the things that we're doing as a community to go through and have a safe as possible holiday season. And if you look at our next slide, because our 7-day moving average is in the 17 is listed at 17 now, we are in stage 3. So the recommendations are for indoor masking in public spaces where you don't know the vaccine status or illness status of someone that you may be in contact with. And that would also suggest that if you have the opportunity to have a gathering outdoors or meet with people, friends and family in an outdoor setting, that would give you better ventilation and provide a safer space for gathering if the weather permits. As always, travel, according to our federal regulations, requires that we wear masks. And this again would be an opportunity for you to protect yourself in other areas where you may be congregating, waiting for whatever mode of transportation you have. If you're standing around people whose vaccine status you don't know, wearing a mask would be helpful. Recent studies have shown that masking is beneficial, particularly if both parties are wearing a mask and if there are prolonged time frames of exposure. Masking for both individuals helps reduce risk of transmission by upwards of 90%. So it's important that we continue to use this relatively benign way of protection. Next slide, please. The Stats for our area show that in the period of November 29th through the 12th of December, we've had 189 admissions. The majority of those have been from Travis County, 57% of those, in fact. Almost all have been unvaccinated. We have record of 2/3 of inpatients vaccine status, and those 2/3 have been unvaccinated. So it's important for us to continue to spread that message for vaccination in our community and boosters for those who are eligible. Next slide, please. We're seeing a week-over-week increase in the number of hospitalizations over the past 4 weeks. The highest number of admissions has occurred in this past week, and we're still seeing that increase more so in the 20 to 69-year-old age range, more so in the 60 to 69-year-old age range in this past week. Next slide, please. We're seeing a disproportionate impact in our communities of color continuing. And as the caller pointed out, our efforts in those communities need to be continued, redoubled, reassessed, and that's an ongoing process that we undertake here at APH because we realize that the need is great. Next slide, please. Year to date, we've had 5,979 cases in our school system. During the last week, we've had 167 cases total, 133 of those were in students. Generally, this is happening in settings where masking is not being done consistently. So it's happening in classroom settings and after school events. It has decreased since the beginning of the year, but of note is that for the entire year last year, we had 3,933 cases total for that entire school year. And this year, since August 16th to present, we've had 5,900. So we see here that masking, distancing, and the time that we've had with virtual learning in our previous year has had an impact in reducing case numbers last year. We know the importance of in-person learning, and it's important that we continue to give our kids the ability to be in class and school when possible. And so we can achieve that by continuing to have masking in place. There have been studies to show that this does not impact emotional growth and development, and it does allow children to interact with each other and play and receive instruction in person. We now have vaccine available for our 5 to 11-year-old age group, and we've been extremely successful in our county in getting children out to get vaccinated. And Director Stirrup will give you the stats on that, but this is so important. And we have an opportunity in the next couple of weeks to not only get our children vaccinated when they're off and out of school, but also give them the opportunity to spend time with friends and family. And it's going to be important that we protect one another with the things that we know we can do so that they don't encounter anybody who has COVID-19 during the holidays. A study came out recently in MMWR that showed that classrooms that use masking have a much lower rate of secondary attacks, so less close contact impact of COVID-19. So those that are sitting around a child who may be infected with COVID-19, if they're wearing a mask, they have a 1.7% chance of becoming infected with COVID-19 if all are wearing masks in the classroom. And that goes up to 11.7% if masks are not being used. Next slide, please. When we started off, we made a conscious decision as a society to protect those most vulnerable in our community and recognize that our elderly population, due to advanced age and immune senescence, decreased immune system capabilities that happens as we get older, and the fact that as we age, we also have more likely some chronic medical illnesses in play. So those things put us at risk for developing illness and severe disease and death from COVID-19. So in an effort to protect our older citizens, and residents and just community members, we set about vaccinating everyone that was over the age of 65, and we've done so. And this graph shows that it's been helpful in protecting them against disease from COVID-19, illness, and death. In the last 14 days, we've had 3 cases in our nursing home facilities. 2 of those were unvaccinated staff members, and 1 was a resident who was vaccinated with J&J in July. None of these cases required hospitalization, and none resulted in fatality. Next slide, please. As I said, today marks the anniversary of our being able to vaccinate our community. And in the past year, we've had 634 people die from COVID-19. Overall, since the beginning of the pandemic, we've had 1,207 deaths from COVID-19. This is a holiday time, and the loss of a loved one for many causes is significant and hard. And those of us who have experienced that loss are undoubtedly feeling the pain of that loss during this time. I would ask that our community remember to call a friend, to reach out to those that you may know have been impacted by this. I don't think anybody in our community has been untouched by this disease. Vaccines have worked to protect people from succumbing to COVID-19. And of the 8.2% of individuals who died who have been vaccinated from COVID-19, those individuals have had chronic medical illnesses that have impacted their disease process and caused their demise. Next slide, please. We've seen over 10,000 breakthrough cases from COVID-19 during this pandemic. 90% of them have been symptomatic. 104 have required hospitalization. That in the face of having deployed almost 1.9 million doses of vaccine. So again, we know that this is a vaccine preventable illness. The breakthrough cases have been associated with and seen in individuals who we now know have had some waxing or waning immunity and comorbidities that have impacted the vaccine efficacy. We now have boosters available, and I'm pleased to say that we've seen a 40% increase in booster uptake since the beginning of this month. So our community is rising to the occasion to get those booster shots that we know are needed to increase our protection from COVID-19. We know that our immunity is being challenged by the new variants. With the Delta variant, we saw a decrease in the effectiveness of the vaccine, anywhere from 50 to 70% reduction in preventing severe disease. We've seen some early reports from what our colleagues have been reporting regarding Omicron, that there may be as much as a 41% reduction in the effectiveness of our vaccines to this new variant, Omicron. We were also being told that boosters will help improve that protection, and so we have been careful to message this to as often and as loud as we can. And our community has been hearing us, and they're going out and getting their vaccinations and their boosters. When I met with you last time, I showed you this slide, and this shows what the state of affairs was regarding Omicron in the world on the 29th of November. And if you go to the next slide, as of yesterday, this is what Omicron has done. It's made its rounds. It's around the world. And yesterday we had a report of 3 preliminary reports of Omicron B.1.1.539, which is the variant of COVID-19 that has been designated the name Omicron. In Travis County, we now have 3 preliminary reports of this. We know from the progression that we now see on this slide from the previous slide that this particular virus variant is on the move. And we have operated as a community knowing that at some point, once it hit our shores, that eventually it would make it to Travis County. But we've not let our foot off the gas. We are continuing to march forward. We are wearing our masks. We are social distancing. We are preparing for the holiday season with the resolve that we have as a community that we will and can protect ourselves from this. So get vaccinated, get your booster shots, mask up, wash up, and test before traveling or gathering with friends and loved ones. Next slide. Thank you. I'll pass it on to Adrian Sturb.
Thank you.
Good morning, everyone. Pleasure to be with you once again. That last slide can be pretty alarming, but like Dr. Walk said, we've prepared for this. We know what to do. And the city of Austin and Travis County have worked tirelessly to make sure that our community has resources in place to be able to take advantage of those tried and true measures that we know work. As Dr. Walks pointed out, last year, on this day, we first started giving out COVID-19 vaccines. Very different scenario. Supplies were limited. It was only for a specific population, and people had to wait to get access. We are now at a point where, as a country, we have more vaccine than we know what to do with. And so in Austin and Travis County, there is ample opportunity for everyone who wants a vaccine to get one. And so again, I encourage you, do the things that we know work. Get vaccinated, get boosted, wear your mask, test and stay home if you're sick. For the month of December, The department issued 7,390 doses. Oh, not even for the month. That's just through the 13th. And that's reflective of that uptake in boosters that we saw. And so I appreciate the community. You heard the messaging loud and clear, and you came through. And we ask that you continue to come out and get those booster shots. As far as testing, we're seeing a decrease in the number of tests that folks are asking for, but we're hoping in preparation for your holiday plans that you will consider getting a test before you leave and getting one when you come back home. And if you are hearing my voice and you think that's a good idea, we have what you need. We are providing testing at the George Morales Dove Springs Rec. We're at the Expo. We continue to offer mobile or in-home testing. Those appointments can be made by calling 512-972-5560, or if it's easier for you, you can call 311. We continue to partner with our senior living facilities, homeless shelters, and other facilities to offer testing in those spaces as well. So remember, if you are sick, please get tested. If you were exposed to someone who tested positive, please get tested. And if you are not sure, please get tested. If you don't want to come out to get the nose poke, you can go to your local pharmacy or HEB and get an at-home kit. They're very simple options. The directions are easy to follow. As Dr. Walks mentioned, in partnership with the Office of Homeland Security and Emergency Management, both Austin Public Health and Travis County neighborhood centers are providing test kits along with their food pantry opportunities. When we look at our vaccines for Travis County over time, as we know, Travis County is 71% fully vaccinated for those 5 and older. The fully vaccinated rate for 12 and up population is 85% first dose and 75% fully vaccinated. You remember when we expanded that category to include our kiddos, we added 114 to the number of folks who are eligible for vaccine. I'm proud to say that we continue to do well as a county. 28% of our pediatric kiddos have received their first dose, and 15.6 are fully vaccinated. When you look at the distribution of vaccine by age as of the 13th, you can see here that we are continuing to see great strides in that 5 to 12 category. But over the last week or two, the largest uptick has been with our booster doses. You can see that we've administered in that 16 to 49 age range, 98,000 booster shots. So we're happy about that. The demand for boosters has been driving vaccine over the past couple of weeks. Some of our sites have been reporting wait times, but nothing too unwieldy. So, please continue to come out. If you're a person who likes to structure your day, make an appointment online, and then that process will go faster for you. But if not, we still have those walk-up options that are available. When we dig down a little bit deeper to look at the demographics of our pediatric vaccine distribution, we're pretty much on par with the population makeup of that age group for Austin and Travis County. The gaps in the Black and Latinx population are not as significant, but are still there. So it actually looks like we're doing a little bit better in terms of meeting that gap. We're hoping that parents will take advantage of the kids being off on break and visit us at any of our sites to continue to protect our kids and community. When we look at the number of Travis County residents who have not yet completed their first course or received their second dose of vaccine, that number is now at 116,000. That's an increase by 6,000. Again, that's a result of adding the kiddos to this group. This is the slide that I wish there was different information, to the point that Ms. Joseph raised and that Dr. Walks mentioned in her comments. The impact of this virus on the Hispanic and Black communities in Austin and Travis County has been they have shared an undue burden of this disease. And unfortunately, we're still seeing that tapering off of vaccinations, with Hispanic at 45% and Black and African American at 33%. A lot of the efforts of the department as well as Travis County are intentional and community focused in order to help drive these numbers. But as Dr. Walks said, we are going to continue to show these slides until the gap disappears. And so when we take a look at geography for our first dose population, we have 4 zip codes that are falling under 70%, and that's 21, 41, 52, and 53 for first dose vaccination. And again, this change is due to adding the 5 to 11 population to the group. And then when we look at the second dose fully vaccinated population, that yellow represents the 50% or lower. And those areas, again, where we are having intentional focus are 78617, 42, 41, 21, 53. And so our vaccine operations, we continue to be at Southeast and Little Walnut Creek Library through the end of the month. So we are offering J&J, Moderna, and Pfizer at those locations. We are at the Pflugerville Library. We're also at the Delco Activity Center. And because we know that, it's the 2 shots, 2 arms deal this month, we are also offering flu at Delco for 6 months and up. And we're also offering flu at Sims Elementary for children 6 months and older. We'll continue our mobile operations. Places we've been or the Thinkery, Perez Elementary, East Austin Early College, and we will continue to respond to requests in the community to support events with COVID-19 vaccinations. And so I was so pleased when I did my check of the media outlets this morning, and the messaging is consistent. Get vaccinated, get your booster. No matter how overwhelming that graph with all those red lines might have looked about how rapidly Omicron is spreading, we know that vaccines still are our best chance at being protected. Prep for the test. If you're planning to go see your family, test before you go and test when you come back. Make sure you aren't taking any virus with you. And that tried and true thing, I know we're all tired of it, masking. Masking is still our best non-pharmaceutical effort to protect ourselves and others from COVID-19. I think about masks the same way I think about burpees. I hate them, but the benefits to my overall body conditioning cannot be beat. And so when she says burpee in the exercise workout, I do it. I hate it, but I know there's a benefit. So I know we have mask fatigue, but I encourage the community. We cannot be tired of a virus who obviously is not tired of us. So please continue to wear your mask. To Ms. Joseph's comments, we are attempting to have a full breadth approach to our outreach. I appreciate her feedback, and we will certainly get with the team to see how we can improve our presence in community radio. As far as our outreach activities, we were in the zip codes that we know are not where we need to be in terms of numbers. I apologize for the typo on the screen. That's 474445. And in 17, we were out there with our community health workers and our health equity unit, passing out information about testing and where the community can access vaccine services. And as always, I like to share pictures. This is our vaccine clinic at the Thinkery. And so kids got to draw and wonder and color and get protected all at the same time. And then again, really taking advantage of that multifaceted strategy. We were at Fluapalooza at KIPP in South Austin, and we continue to support many of the food distribution events. We were at Dove Springs along with the food pantry. So those boxes there you see are all the shelf-stable goods that families can receive. We continue to give out PPE. We continue to give out hand sanitizer. We want to make it as easy as possible for people to do what's needed to protect themselves. And lastly, before I end the presentation, it has been a year since we've been in this. I always give credit to Austin Public Health and Travis County, but the City of Austin employees continue to stand up for this community. It has been a cross-departmental collaboration to continue to support our community to make sure that we have the best outcomes with respect to COVID. So I appreciate all of the departments that continue to help us staff these events. I appreciate the leadership and continued support of City Manager Cronk and Assistant City Manager Stephanie Hayden Howard, as well as these two bodies in terms of the policy decisions and resources that you have allocated so that we can continue to do this good work. And with that, I will end my presentation. Thank you.
Thank you. Chuck, I'll turn it over to you.
Good morning, Judge Brown, Mayor Adler, commissioners and council members. Chuck Brotherton, Travis County Executive for Emergency Services, here to provide y'all a quick update on the activities of our county mobile vaccine collaborative, here with Constable George Morales of Precinct 4 and Todd Hamilton with the Central Texas Allied Health Institute. And at this time, I'll turn it over to Constable Morales.
Good morning, commissioners, council members, judge, and mayor. This past week, with our partners, the Mobile Vaccine Collaborative has done 2,811 shots for this past week. Total vaccines for the month is going to be 5,986, with 1,647 of those being pediatrics under 5. We had to cancel 2 outdoor clinics this past weekend due to inclement weather. Our tents were flying around, so to be safe, we had to go ahead and cancel that one before we actually got started. We had a total of 2,740 flyers go out and 850 phone calls made to target the areas of 787-5853, 787-24, 787-41, 787-21, Del Valley, Austin Colony, and 787-44. We will continue working with AISD targeting Title I schools. This week we have our static locations, Mendez Middle School and Keeling Middle School. We will be providing pediatrics to include boosters at IDEA schools this week. We will continue our static locations at JD's Grocery Store, Staley Middle School, and Del Valley Opportunity Center. This week we have 46 events scheduled to include Palm Elementary, the Mexican Consulate, AISD Performing Arts Center, and of course LULAC Manor and IDEA schools. I'll turn it back over to you, Chuck.
Thank you, Constable. Mr. Hamilton.
Thank you, Chuck. Good morning, everyone. As Constable Morales has said, working with the County Coalition, Central Texas Allied Health Institute have been responsible for 922 different vaccines for this month. 62% of those vaccines have come from adults, which yields 575, which gives me 38% has come from children, 347. We continue to work within the Eastern Crescent of the city, whether it's at our static location off of 1400 Tillery, or if it's off of or if it's out in the community in Manor, Ideal Schools, or any of the Title I schools with Austin ISD. We are wrapping up, or we have wrapped up both rounds of those for those particular ISDs, and we're continuing to move throughout. And wherever Constable Morales and the coalition volunteers us for, that's where we'll be at to continue this fight. And I'll yield back to Chuck.
All right, Todd, thank you. Judge and Mayor, just like quickly to share the county's website to point people, our viewers, to how to find vaccination information, the locations that we are hosting this week, as well as Austin Public Health, as well as our partners in Williamson County. On the county website, public-facing website, a quick link right there at the top left of the page will take anyone to our calendar for vaccine events day by day through the week. And then selecting any one of these links provides all of the site information, details on the shots that are available, whether appointments are needed or not. But for most of these, we are continuing to be barrier-free. No appointments needed for the county locations. And as you heard from Director Stirrup, Austin Public Health is also hosting lots of barrier-free, no appointment required walk-up vaccine clinics. That will do it for us. Judge, I'll turn it back to you for questions.
Thanks, everybody. I will turn it over to Commissioner Gomez first for any questions or comments.
No, Judge, I really don't have any questions. I think that we're getting the word out, and we seem to be going to the area where children are, and I think we're getting our message out. Sounds like it. So thanks very much. Looks like a lot of hard work has been done, and so I'm very appreciative of that.
Thank you. Commissioner Shea?
Yeah, I just wanted to ask Constable Morales, because I continue to be so impressed with how much effective outreach you're doing. Would you repeat the numbers of people that you reached? I want to make sure I got them right.
We did 2,740 flyers and made a total of 850 phone calls.
But the people that you vaccinated, was it, I remember 2,000 and 5,000?
Vaccinated. We vaccinated 2,811 for this past week. For the last 2 weeks combined for December, 5,986, 1,647 of those being pediatrics.
That is phenomenal. And can you just say really briefly about the calls that you're doing? Because I think you all have been really creative about kind of capitalizing on some of the outreach that was done around the census, trying to engage communities that are hard to reach and might be reluctant to participate. Can you just say a little bit about how you're doing that? I was really impressed when I went out and toured with you guys and saw all of the creative approaches you were taking.
Sure. Well, first, we owe you a real debt of favor on that one, because we have access to phone numbers that were given us through CAPCOG. And so we have a stronger and larger reach now into these communities. Basically, we call people and ask them if they would like the vaccine. We do answer some questions about concerns of the vaccine. We do want them to do a follow-up with our 854 SHOT call center with Travis County Health and Human Resources. But a lot of those people that we call are again, the 8 highly affected zip codes. Those are our targeted areas. And we could make up to 4 calls. And assuming, we get a do not call us back. We do document that, but majority of the time, I would say that's more like 10%. 90% of them do have those questions. 90% of them do want to know where our locations are at. So, we will continue to call into those areas. The areas that we block walk in, we do flyering of shot locations and some COVID information. A lot of that is some of the information is offered through Austin Public Health, and we're very appreciative of that. So we're going to continue to do what we have to do to get the messaging out.
Well, it's phenomenal. I think you're doing really outstanding work. So I just want to shout that out. Thanks to all of our staff who are continuing to try and keep people safe. And I hope people are getting the message that they've got to take the precaution that's available, because we don't have the capacity in the healthcare system. We're hearing all these horrible stories around the country for communities where people who are genuinely sick with other conditions can't even get into the hospital because they're so full with COVID patients. So thank you, all of you, for all your work.
Commissioner Trevilian.
I just want to echo my thanks for the work that you all have been doing, particularly in Title I communities and in communities where outreach is difficult or our normal outreach methods do not render the results that we're looking for. And my question really is, we are about to go through a period, probably starting this Friday through mid-January, where schools are not going to be open. Do we have a specific strategy, or should we develop a specific strategy to address the needs of kids and families who are out during this time period and would like to get their vaccinations? Meaning, are we looking at community centers or places where youth for recreation? Are we targeting churches? Are we looking at places where people congregate, like malls? What are we planning to do in the period where our Title I kids are not going to be physically at school location? And is there anything that we can do, or any more resources that we can provide to make sure that we don't lose ground during the period in which schools are closed?
Well, I'll start, and I neglected to mention this in my presentation. Dr. Walks has worked with the GIST to create a PSA that is specifically targeting African Americans, and we've reached out to several of the pastors of the larger churches on the east side to ask if they will run the PSA not only during their church announcements, but to also attach it to their social media feeds so that we can get that word out there. I know that the team is working on a variety of place-based events in communities, not necessarily in schools, but we can definitely work with the GIST on specific messaging. We will continue to have our clinics at Sims, Delco, and Pflugerville during the holidays. And so just making sure parents know that, even though schools close, we're not, and we are there to continue to serve in those places and spaces. But definitely can take a look at a more concerted approach in youth serving areas or facilities.
Commissioner, we will continue to push at our static locations. We do have some county holidays coming up, but during that time, we're going to continue to push information out to static locations and try to work directly with Austin Public Health for additional shot locations that are in the area.
I just want to make sure also that as we ask people to work during their holidays, that we make sure that they're compensated for emergency pay for the time in which they're serving their community.
Commissioner Howard?
Thank you. I was wondering from Adrian or Dr. Walks if our success with vaccination in communities of color is, sort of on par with what we're seeing in other communities, or are we ahead or behind?
I don't have a specific comparative analysis, and maybe Dr. Walks does, but yes, in communities, in other cities and peer cities, there is this lag, this gap in cities outside of Texas, where they've seen significant increase is the implementation of measures that are not available to us here. Vaccine passports or other type of measures that, I guess I'll say it, mandates. New York was one of the places that we were asked to talk to specifically. And the commissioner there was very clear that until they started putting some of those measures in place, they were seeing that significant lag. There was an in-between step that he did mention that seemed to have some traction, and that was being in entertainment spaces. You know, attaching vaccine opportunities to concerts or to restaurant week. He said they did a big push during their restaurant week in August. And so as we are embarking upon our festival season, fingers crossed, that can be something that we would work with event organizers. And we do have precedents for that here. We did see with ACL and the support from C3 that a lot of folks were incentivized to go out and get their vaccine to be able to participate in the event.
Thanks. Yeah, I just want to say thanks again, especially on the pediatric stuff. It looks like, again, if my math is right, we're at about 28% of our eligible pediatric population that's been vaccinated. So that's up since last week, and we're still, I think the state's at about 15%. So if that math is right, then we're about 13% above the statewide rate. And I want to commend everybody who's worked on that, from especially Constable Morales, APH, but then also our community partners, AISD. Dr. Elizalde has been absolutely amazing in focusing and making available the vaccine for kids. Dr. Telly with Del Valle ISD, again, has been absolutely amazing, making the vaccine available for kids. UT School of Nursing, Ascension Seton, of course, and others. And I think the fact that the numbers more closely follow the population numbers and the demographics of kids shows that I think when we go where people are, which I think we've been able to do better in this population, because we know kids are in public schools, kids are in Title I schools. And I just want to recognize that to me seems to be the thing that works really well. We obviously still have work to do in the general population of making the vaccines available where people are. But again, Constable Morales and his team and APH and your team have done great work in going into the community, making it more available. I mean, Constable Morales' idea of having it in grocery stores and Chief Bailey's idea of putting it in JDs, that very first, I don't know, even remember what month that was, that just led to this entire effort of making it more easily accessible when people are doing something else that they're already going to be doing and they see the vaccine there. That's, I think, where we really have success. So just want to thank everybody and reiterate that we hopefully can keep focusing that way. And I will pass it on, Mayor, on over to you, unless Constable Morales or Adrian, if y'all have any other thoughts on that. Lavish praise that I'm giving to your work. Y'all are doing great stuff.
I will say thank you, and the staff say you are spot on with your figuring.
Okay, good. Right on. So that's, 28% locally, 15% statewide. Okay, Mayor Pro Tem, I guess I'll pass it on over to you.
Thank you, Judge Brown. We're going to start with District 10 for questions and then work our way down to District 1. Councilmember Alter?
Good morning. As we mark this 1-year anniversary, I want to join in thanking our staff, both the city and county, for all of the work and all of the professionals across our community who've been helping to get folks vaccinated. I wanted to ask a question about our own workforce, and I'm not sure if this is a question for the city manager, for Austin Public Health. It's been several months since we've heard any statistics about how COVID is impacting operations and how it is impacting our personnel. We had questions about whether we would be able to do mandatory vaccination, and that was not a path we went down. But at one point we had certain departments that were experiencing very high absence rates that were then impacting service, et cetera. Can someone speak a little bit to what we're seeing now, particularly within public safety, but more broadly about how COVID absences and where we are at, how COVID absences are affecting the city's functioning and what we know about vaccination rates among our personnel?
I'll certainly start out, Councilmember. Thanks for the question. We fortunately have not seen significant impacts to our operations from the department standpoint over these last several months. We continue to monitor and ensure that every employee is able, and if they want to get the vaccine, that we make that available to them. And so we have seen an increase in rates of taking the vaccine from across our employee base. We clearly don't have the actual numbers at this point in time, but I will follow up with HR to see if there's any additional information that we can provide to the council. Before I close, I'll just see if ACM Hayden Howard wants to add anything.
Muted.
I think you're muted, ACM Hayden
Stephanie, you're
Howard.
muted, yeah.
We'll get back to Stephanie, but I'll follow up with you, with the council after I talk to HR to get some additional information, council member.
Yeah, I just think it would be helpful because at one point it was really, over the summer creating some big challenges in terms of staffing, particularly for our public safety departments. And so it would be helpful to get an update and have an eye on that if we do experience a surge, so that we're aware of what's going on and any steps that can be taken to address that, and just be curious what's working to get folks to get those vaccines among our personnel.
One example I'll just mention, APH has been incredible in meeting departments where they're at too, and so hosting town halls, making themselves available for smaller gatherings of employees so everyone can ask questions, get answers, and so they did a big push in that regard earlier in the fall, and I think that was very helpful.
Are you done, Allison?
Yes, thank you.
You're welcome. Councilmember Tovo?
Thank you, and thank you all for your continued work on so many fronts. I really appreciate all of our public health professionals who have just been nonstop trying to keep our communities safe and get vaccines out and testing. So I had a couple, one I'm going to make as a comment since we're only supposed to ask one question, but as I started hearing about Houston's wastewater testing over the last week or so, that got me thinking about Austin's. And I know I and others had asked questions about that early on, and there was a pilot program at UT to do that. And as I understand it, halted because of lack of funding and personnel. And so, this is really something for the future. I'd be interested, once we're well past this, I'd be interested in really better understanding what the value of that was for cities like Houston that were able to continue it, and whether that's something that we should think about, really sourcing up in the future through our partnerships with other entities. Was that able to yield information that we couldn't through other means, especially, as I understand it, one real benefit is that it gives a heads up about the virus sometimes before the testing shows up, because it's also, of course, measuring asymptomatic individuals who are asymptomatic. So just kind of for future, again, once we're past this particular crisis, it'd be interesting to compare cities like Austin to Houston and the value that some of those cities got from that testing. And two, I just want to appreciate the messages about testing. I was out of town over Thanksgiving, and after hearing several messages from our public health department about doing that testing, as a precaution before you're around family or in gatherings, I did go and get tested this weekend. So I'm happy, as somebody who's now vaccinated and boosted. I was also having cedar fever, coughs and sniffles and things like that. So I just want to encourage, I just want to amplify that message that you all gave. It's really, I'm really happy to know that I can go to those gatherings knowing that I do not have COVID and I'm not in the position of infecting others. So thanks for continuing to get those messages out and to talk about, the ways and the various permutations of that and why you might want to do that, whether you've just traveled or planning to travel or about to be in the midst of other gatherings. I did want to suggest, add on to really what Commissioner Trevelyan said about capturing families, and especially families with children at places where they might be when school is out. And I wanted to suggest that just ask if you had any plans to do that with testing. And I know our public health and our partner organizations are really stretched right now doing all of this work. But I wonder if any of the private sector folks who are doing testing might might be interested in, say, setting up at the airport or at malls to do that kind of testing for people who are out and about and might want to get that same surety that they too are COVID free. So I guess this is for Director Stirrup. Are there any plans to do that? I know when I was in New York City recently, there were, on lots of blocks, there were little mini testing facilities. Sorry, so they're really easy to access. When I was making my appointment, it was a little more challenging. A lot of the places were a day or two out, which is the good news of that, I guess, is that a lot of folks in our community are getting tested. The downside is we want, everybody who has any questions about what their status is to be able to get that testing pretty quickly. And so I'm wondering about having both vaccinations, but also testing in some of those really areas that we know are going to be highly populated through the holiday season.
My initial reaction, and I will always go back to staff to get their expertise, is that we would not want to encourage folks who are sick to be in places with a high foot traffic. We typically try to keep the testing operations in spaces where there isn't a lot of interaction with a larger population in a space that allows for a big enough footprint and throughput rather, so that we can keep not only folks seeking tests safe, but those who are administering the tests and doing all of the data collection work. That being said, we do have the mobile testing options available. If folks call 311, they can schedule those tests. And we are making a big push to distribute those kits that HESM has acquired. And perhaps that could be the compromise strategy, that we make sure that those kits are more widely available to parents and families in places that they might frequent, rather than setting up an event that would cause exposure. And I know what you're talking about. When I was in New York in October, there were like little pop-up tents on every corner in downtown Fulton Street in Brooklyn where you could get a quick swab. But for consideration, and we'll take that back to staff. I do want to note that staff said that they are exploring a wastewater project with the CDC and Austin Water for our location. So more on that as that develops.
Great, thank you. And Director Stirrup, thank you for that. I completely understand your point that we don't want to encourage folks who are sick to go in those places. And so, I think what I was envisioning was more kind of like drive up solutions in the park, in the parking lot of those kinds of busy spaces. But I appreciate your thinking about the distribution of the kits in some of those places. And thanks for the other info.
Councilmember Ellis.
Thank you, Mayor Pro Tem. I'm wondering if there's any more updated information about either the vaccines for those under 5 years of age or for boosters for those who are in the 5 to 11 age group. At what point that's appropriate for them to plan on getting a booster?
I'm glad you asked that question. There was a comment made on a call this week that they're anticipating sometime after the first of the year to see an application being made for consideration of the under 5 age group vaccination. So more to come on that. No definite dates, but that was encouraging to hear that. I thought about you.
I look forward to that information coming out, and just really appreciate all the work that everyone's doing on this.
Yeah, thank you.
Councilmember Poole.
There we go. I don't have any questions, just my appreciation extended once more to the team, the cross-discipline team. Thank you all.
Thank you. Councilmember Kelly?
I don't have any questions either. Thank you.
You're welcome. Councilmember Kitchen? Oh, actually, I don't know that she's with us today. And it looks like Councilmember Casar might not be with us either. Councilmember Fuentes? I'm sorry, Councilmember Renteria?
Yes, I don't have any question. I just want to encourage people to go out and get your vaccination. You know, we're in the flu season where there is a cold bug out there, the cold. It's really going around. It's causing some really severe symptoms. So I encourage you to wear your mask, even if you're vaccinated and your booster, wear your mask out there because there's a lot of other nasty bugs out there that just can't wait to get you. Thank you.
Thank you. And it looks like Councilmember Fuentes is not with us either, in which case I'll go to me in District 1. I also don't have any questions. Enduring appreciation for everybody's effort around us really just trying to get a hold of this virus and the variants that go along with it. I am also, like Adrian Stirrup, I hate burpees, and I'm getting to the point where I hate these masks. I'm developing a little rash, and my glasses are always foggy, but I also have so many friends who are fully vaccinated and boosted and still contracted COVID-19. And so I'm operating like the mayor out of an abundance of caution, and I encourage everybody else to do so. I really appreciate the fact that we are still in stage 3 and hope we don't go to 4 or 5 and look forward to everybody being well and moving into this holiday season thoughtfully. I think the one question I would have, if I had one, in fact, it's not a question so much as a statement. I'm concerned about all the holiday travel and what that will bring. So I just, again, would encourage everybody to be as safe as possible and think about everybody around them. Judge, I believe that's it for us.
Can you hang on a second? I'll take
Oh, I'm sorry, Mayor Adler.
That's okay. First, just want to remind everybody that we have a special call in order to extend the enforcement and standing of Dr. Walk's orders. The county is passing one today. We need everybody who is on the screen right now to participate, or we're not going to be able to do that. So we need everybody to vote. It won't take long, but please make sure that you join the next meeting. And I appreciate the county taking that action as well. We're coming to the end of the year, and I just want to say thank you also to APH, to Dr. Walks, to Dr. Escott, to everybody that's worked on this. The bottom line deal is that the states, the number of people who have died in Texas because of this virus is almost 80,000 people. I think it's like 75,000 right now. And that's just a staggering number. The mortality rate in Austin, less than half of the state's mortality rate. If the state had been able to achieve what we've achieved here locally, almost 40,000 Texans would still be alive. And I recognize that every different area, part of the state is different, and you just can't, expect the numbers to be statewide. But nonetheless, our staff, APH, the county workers, city staff, really have done a phenomenal job relative to our state and even relative to the rest of the country. We're among the communities that have best responded, and the results show that. And I just want to end this year with thanking everybody for that. And it is significant, and it was the most pressing issue in this city and in this country and in the world over the last year, probably the last 2 years. So I just wanted to say thank you for that.
Thank you. Mayor Pro Tem, so I guess we're going to adjourn or recess until 10:35, Commissioner? Is that good?
I think we can make everything work between it.
Okay. Sounds good. We'll stand in recess till 10:35, and I'll pass it over to you, Mayor Pro Tem, to do the same for.
Thank you, Judge Brown. Colleagues, after we adjourn, we're going to take a brief 5-minute break before heading into our special called meeting. So if there's no objection, the city's portion of the joint meeting is adjourned at 10:20 a.m.
Thank you so much, and we'll be
Thanks, Judge.
adjourned.
Thanks, Commissioners.
Everybody come over.
Thanks.
Y'all take care.
Like a needle in a haystack, a 1 in a million chance. Red beans, rice, and gravy, a song and a dance. That's married life. That's married life. Oh me, oh my, yeah, that's married life. Yeah, that's married life. That's married life. Oh me, oh my, yeah, that's married life.
One day in the sun, one that would become something to me. What did I see? One face in the crowd, put me in the clouds, looking at you. What could I do? I've looked to find nobody knows your name. I might go blind, maybe I'll go insane. Not everyone's to blame, just one. One shot in the dark, hit me from the start, spinning me around, chasing you down.